This is my assignment for science. We are given a disease to research. I have chosen kidney cancer. My dad has it. I'm going to interview him and ask how he got it and what the future is going to be like for him. Dad, first of all, how long have you had kidney cancer?
I've had kidney cancer since February, so that would be about 8 months. First of all, the kidney was removed, but apparently it spread through my body, which we'll start talking about how they're going to deal with that. When they found it, the kidney cancer had been growing in my body for about 5 years.
What is the medical term for it?
It's called renal clear cell carcinoma. Renal means kidney, so it's kidney clear cell carcinoma. When talking to the doctors, they just call it kidney cancer. They don't use the big, long medical term.
How does renal clear cell carcinoma start? How did you get it?
Well, all cancers throughout the body are just mutated cells. In this case, the cells in the tubes in my kidney, which is a kidney is used to clean your blood, the cells mutated there, and over about 5 years grew to about the size of a softball.
Do you have any symptoms?
There was only one symptom. Just all of a sudden, I had blood in the urine. There was no pain. There was no warning or anything else like that. I just went to the toilet and there was blood in the urine, and that night it got worse and worse. I had stomach cramps and a few other little odds and ends. My wife took me to the hospital, and the next morning, by the time they'd done some scans and some other tests, they'd discovered that I had kidney cancer.
I've been researching it, and they say that obesity, high blood pressure, a family history of kidney cancer are some of possible factors.
Well, those sort of things increase your chances of getting kidney cancer, but it doesn't mean you will get kidney cancer. It just increases the factors. It's basically statistics. Statistics also say that kidney cancer mostly occurs in men over 40, but women get it, younger people get it. It's just the high statistic is men over 40.
How do they detect it?
Well, they detect it two ways. One's a CT scan. The other is called a PET scan. I'm not sure what the CT stands for. I think it's computer topography. And what they do is they take pictures of your body, either an X-ray or something like that, in layers, and they can see what's going on. And it showed that there was something bigger in one kidney than in the other kidney. After that, I got sent for a PET scan, and what they do is they put a little bit of nuclear medicine inside you to make everything sort of glow. And with that scan, the same thing, they take it in slices, they can see exactly what's going on, and that's how they identified that I had kidney cancer, that one kidney was a lot bigger than the other one, and it had a cancerous growth in it, a tumour, about the size of a softball.
You had a surgery, a nephrectomy. Is that the only way to treat your condition?
Yes, usually surgery, as far as kidney cancer concerned, surgery is the best way to go. There's two ways of doing it, and there was two surgeries. One is called partial nephrectomy, which means they only take part of your kidney out. That's if you've only got a small bit of cancer in. But in my case, it had pretty much taken over the whole kidney, and that was called a radical nephrectomy, where they took the whole kidney. But not only that, they also took a bit of the tissue around the outside, because there's lymph nodes near your kidney, and those lymph nodes help to spread the cancer. So they took the whole lot out. It ended up being about the size of a football, the amount of tissue and kidney and cancer that they took out of my body at the time. As far as the surgery goes, technology has improved over the years. When surgery first started for kidney cancer and remove all the kidneys and replacing kidneys and things like that, they used to make an incision pretty much from the middle of your chest around to the middle of your back, in between your rib cage and your hips. And it took you a long time to recover from that. It was 12 to 14 weeks, maybe longer. You were in hospital longer, you were in more pain. There was a lot of side effects to having that sort of surgery, whereas what I had was a laparoscopic technique, which is a small, they call it a pinhole technique. It wasn't exactly a pinhole, but it was a lot better than that. And basically they made a couple of holes in my back under my rib cage, and I have a scar that's about that long, about 6 inches long, where they took the kidney out. I was in hospital for 3 days. Recovery was about 6 weeks, and I was fine, went back to work, and it was like the surgery had never happened.
So is that it? You're cancer-free now?
Well, no, I'm not cancer-free now, because it was discovered within 6 months that the cancer had spread, probably through the lymph nodes. I currently have cancer in my just near my tailbone and my hip, and also it's been diagnosed in my left rib, and there's spots in my lungs. Now, in my lungs and my rib, it hasn't spread. And kidney cancer is a really weird thing. It might be there for years and not do anything. It might disappear, or it might all of a sudden just grow. However, the cancer in my hip is growing. They've proved it over successive CT scans, and I'm currently about to undergo radiation to kill the cells in my hip. Following that, they will give me drugs to try and slow down the growth of the other areas where I currently have kidney cancer.
What choices do you have for the treatment?
Well, as far as I understand it, there's four different choices for treatment. There's radiation, which I'm about to currently undergo. There's also chemotherapy, there's drugs, and there's immunotherapy, which is relatively new. Radiation involves giving you X-rays or gamma rays or whatever the rays are to directly attack the spot where the cancer is growing. Chemotherapy is giving you chemicals into your body and try to kill the cancer that way. Drugs also try to slow things down. And immunotherapy works the other way to chemotherapy. Immunotherapy is like giving your immune system steroids, and it really kickstarts your immune system to try and kill the cancer naturally. It's a fairly new thing that as they've explained it to me. I'm not up to that yet, but that's one of the possibilities. At the moment, though, for my cancer, they're going to deal with the radiation, and then they'll give me drugs to try and slow down the growth of the cancers.
Are you going to reject any treatments?
Okay, some people refuse treatments for various reasons. There's all sorts of cancers, I should say, and depending on the severity of the cancer, how aggressive it is. For example, pancreatic cancer usually has a high mortality rate, and I think it's like 70% of people that have it usually pass away within 2 or 3 months. Chemotherapy is very hard on the body, drugs are very hard on the body, and depending on what sort of cancer, people opt to not take that treatment, especially if it's been made as terminal or determined that it's going to be terminal and there's not much that they can do about it. They choose not to go through being uncomfortable, being sick all the time while they're on chemo, losing their hair. Same with taking drugs. They choose just to live their life out as normal and be with their family and do whatever. I'm nowhere near that. My cancer is in the very early stages, and I'm quite happy to have the radiation in a couple of weeks as well as take the drugs to try and slow things down. And they've promised me that every 6 months I will get a scan, and in those scans I'll have a look at what's changed in 6 months and address whatever has changed in those 6 months. So I've got a high livability rate, for want of a better word, and I should be okay.
It's not terminal, but are you going to always be sick when you're older?
Well, no, I'm not going to be sick, other than when they try new drugs, they told me that it takes you a week or so to get used to the side effects of whatever the new drug is. But other than that, I won't be sick because they'll be on my cancer very early. So they'll know any changes within 6 months within my body, and they'll be able to see, okay, there's cancer starting to grow there. Let's address it straight away before it gets hard. With kidney cancer, about 90% of the time when they diagnose it, the doctors were looking for something else. They didn't even know it was there, but it just came up in the scans and they went, what's that? And let's go and have a look, and that's how they find it. That's not something that doctors can find easily. And they've also told me that it's a weird cancer because sometimes it doesn't grow, it just sits there, sometimes it goes away, and sometimes it grows exponentially. It just depends on what it wants to do. But I'm going to live a long, full life, and hopefully I'll be able to see my grandchildren grow up as well. Thank you.
Thanks, Dad. Thank you for helping me with my assignment. And I hope your treatments don't make you feel sick.